Electronic health records meaningful use. A word from David Blumenthal, National Coordinator of Health Information Technology.
Hello, I'm David Blumenthal, National Coordinator for Health Information Technology. I'm pleased and excited to say that the registration process is now open for healthcare providers to obtain significant incentive payments for adoption and meaningful use of electronic health records. The incentive payment program is aimed at accelerating the nation's adoption of health information technology. Healthcare providers throughout the nation can qualify for this funding. Under the HITECH Act of 2009, Congress set aside up to $27 billion over 10 years to help support providers' adoption and meaningful use of electronic health records. Doctors and other eligible professionals can qualify for incentive payments totaling as much as $44,000 through Medicare or $64,000 through Medicaid. Hospitals can qualify for incentive payments totaling some $2 million or more. National adoption of health information technology will constitute an historic turning point for healthcare in America. Starting with adoption and meaningful use of electronic health records, health information technology will provide better care for patients, easier care to provide for providers, and long-term healthcare cost and quality improvement for the nation as a whole. High-tech programs, combined with professional leadership, are turning the tide toward a future of HIT-assisted and supported healthcare. After years of sluggish adoption, healthcare providers are planning to take the plunge. 81% of hospitals plan to take advantage of the incentive payment program, and 80% of those plan to act during stage 1. That's in 2011 and 2012. That means that 2/3 of the nation's hospitals are already planning to act in the next 2 years. For their part, 41% of the nation's office-based physicians are also planning to take advantage of the incentive payment program, and 80% of those are planning to act during stage 1. Only 14% of physicians say they will not act to become meaningful users of electronic health records. That means that 1/3 of the nation's office-based physicians are already planning to act in the next 2 years. Why are providers choosing to go now? Availability of incentive payments is one reason. Availability of federally supported technical assistance is another. The guidance provided through the meaningful use process, which provides clarity regarding how to use electronic health records and assurance that certified electronic health records will support those uses. And leadership by the nation's clinical and hospital professional organizations are a very important element. Cooperative leadership and unprecedented new resources are making the difference. We recognize that electronic health record adoption and meaningful use are hard work and big investments, especially for smaller practices of primary care providers. That's why incentive payments and technical assistance have been made available under HITECH. Incentive payments can offset a significant amount of the investment. 62 regional extension centers across the nation are prepared to offer customized, on-the-ground assistance, especially to providers without significant HIT resources or expertise, such as small practice primary care physicians and small hospitals. All providers owe it to themselves and to their patients to learn about this incentive program and the other supports. The number of providers already planning to act is gratifying, but we believe that many more still need to learn about the opportunities they have. Acting during stage 1 means maximum funding through the incentive payment program. Beginning in 2015, providers will see reductions in their Medicare reimbursements for not meeting requirements of meaningful use. We believe it is in providers' interests, patients' interests, and the nation's interests to move during stage 1 to the adoption and meaningful use of electronic health records. We are committed throughout this process to protecting the privacy and security of personal health information. All the information that providers need is at the CMS website at cms.gov/EHR incentive programs. To contact the Regional Extension Center that serves their area, providers can also find Regional Extension Center contact information at healthit.hhs.gov/REC. Thank you so much for your time and attention, and good luck with becoming a meaningful user of electronic health records.
To recap what Mr. Blumenthal said regarding electronic health records' meaningful use, EHR meaningful use is the use of health information technology, HIT, that leads to improvements in healthcare and furthers the goals of information exchange among healthcare professionals. The High-Tech Act. The High-Tech Act is Health Information Technology for Economic and Clinical Health Act. It is part of the 2009 American Recovery and Reinvestment Act, ARA, that was passed by the U.S. Congress, and it provides incentives to physicians to adopt electronic health records. The high-tech funding will be used to provide incentives to providers who use IT, strict and open standards to ensure users and sellers of electronic health records work towards the same goal, and certification of software to provide assurance that the EHRs meet basic quality, safety, and efficiency standards. Incentives for providers. Over the next 5 to 6 years, eligible professionals will receive maximum of $44,000 under the Medicare program and $63,750 under the Medicaid program. Providers who choose not to adopt EHR by the year 2015 will be subject to a penalty of 1% of the Medicare payments, and that will increase to 3% over the following 3 years. This is a chart for maximum EHR incentive payments by program based on the first calendar year for which the eligible professional received payment. You will find a copy of this chart in your handout package. And you will be able to calculate your payments depending on the year that you start adopting electronic health records and under which program you become eligible. To get the maximum incentive payment, Medicare eligible professionals must begin participation by the year 2012. Note that Medicare eligible professionals may not receive electronic health record incentive payment under both Medicare and Medicaid, meaning if you are eligible under the Medicare program, then that is the program that you will qualify for, Medicare. If you are not eligible under the Medicare program, then you may be eligible under the Medicaid program if you meet the conditions for the Medicaid program. The Medicaid EHR Incentive Program is a voluntary program established by Congress. However, it is administered individually by each state and territory. If you wish to find your state and the estimated date that registration will begin for the Medicaid EHR Incentive Program, you can go to www.cms.gov/apps/files/statecontacts.pdf. Are you an eligible professional? How do you determine if you are an eligible professional? This is a flowchart to help eligible professionals determine eligibility for the Medicare and Medicaid Electronic Health Record Incentive Program. To determine if you are eligible and under which program, you can start right here. The first question to ask is, did you perform 90% of your services in an inpatient hospital or emergency room hospital setting? If your answer is yes, then you are not currently eligible to receive an EHR incentive payment under either program. If you answer no, the next question is, were at least 30% of your services furnished to Medicare patients in an outpatient setting? And there is a 20% requirement for pediatricians. If you answer yes, and you are one of the following providers, then the answer is yes, you qualify if you adopt, implement, or upgrade to successfully demonstrate meaningful use of certified electronic health record technology. Then you may be eligible to receive incentives under the Medicaid Electronic Health Record Incentive Program. However, if you answer no, the next question to ask is, did you practice predominantly in an FQHC or RHC with a 30% needy individual patient volume threshold? If you answer yes and you are one of the following providers, then you qualify under the Medicaid program. If you answer no, the next question is, do you bill the Medicare physician fee schedule for patient services? If your answer is no, then you do not currently qualify to receive an EHR incentive payment under Medicare and Medicaid programs. However, if you answer yes, and you are one of the following providers, and you successfully demonstrate meaningful use, you may be eligible to receive an incentive under the Medicare Electronic Health Record Incentive Program. You will also find a copy of this flowchart in your handout packet to help you determine your eligibility and under which program. Why EHR meaningful use? EHR meaningful use goals. 1. To improve care coordination by providing access to comprehensive patient health data for the patient's healthcare team of professionals. 2. To reduce healthcare disparities by reporting to patient registries for quality improvements and public reporting, and also by generating lists of patients who need care and reminders. 3rd, engage patients and their families. Provide patients and their families with access to data, knowledge, and tools to make informed decisions and better manage their health. 4. Improve population and public health by communicating with public health agencies. 5. Ensure adequate privacy and security. Ensuring protection for confidential information through operating policies, procedures, and technologies, and in compliance with applicable law. The goals for EHR meaningful use are to be achieved in 3 stages over the next 5 years. At the present time, only Stage 1 has been defined, and it is to be completed by the year 2012. The first step in achieving meaningful use is to have a certified electronic health record, EHR, and to be able to demonstrate that it is being used to meet the requirements of Stage 1. Stage 1 contains 25 objectives divided into 15 core requirements and 10 menu requirements. These core requirements are Use computerized order entry for medication orders. Implement drug allergy checks. Generate and transmit permissible prescriptions electronically. Record patient demographics. Maintain up-to-date problem list of current and active diagnoses. Maintain active medication list. Maintain active medication allergy list. Record and chart changes in vital signs. Record smoking status for patients 13 years old or older. Implement one clinical decision support rule. Report ambulatory quality measures to CMS or the states. Provide patients with an electronic copy of their health information upon request. Provide clinical summaries to patients for each office visit. Capability to exchange key clinical information electronically among providers and patient-authorized entities. Protect electronic health information, privacy, and security. The menu requirements are: implement drug formulary checks, incorporate clinical lab test results into certified EHR as structured data, generate lists of patients by specific conditions to use for quality improvement, reduction of disparities, research and outreach. Send reminders to patients per patient preference for preventive and/or follow-up care. Provide patients with timely electronic access to their health information, including lab results, problem lists, medication lists, and allergies. Use certified EHR to identify patient-specific education resources and provide it to patient if appropriate. Perform medication reconciliation as relevant. Provide summary care record for transition in care or referrals. Capability to submit electronic data to immunization registries and actual submission. Capability to provide electronic syndrome surveillance data to public health agencies and actual transmission. The following is an example of certified EHR Vista, which is currently being used by the Veterans Administration Hospital. Note on this one screen how many requirements are being met. You will note here that patient's demographics are present. Patient identity is confirmed by the date of birth. Here we have the list of active problems, the list of allergy to medications, active medication list, clinical reminders, record of lab tests, record of vital signs. Eligible professionals who are using certified EHR need to register and attest for the Medicare and Medicaid incentive programs at www.cms.gov/EHR incentive programs. To register, you will need the following information: your National Provider Identifier, NPI, and your National Plan and Provider Enumeration System user ID and password. If you are reassigning your benefits, you will need your payee tax identification number and your payee National Provider Identifier, NPI. Eligible professionals then will agree to the following attestation statements. The information submitted for clinical quality measures was generated as output from an identified certified EHR technology. The information submitted is accurate to the knowledge and belief of the EP or the person submitting on behalf of the EP. The information submitted is accurate and complete for numerators, denominators, exclusions, and measures applicable to the EP. And the information submitted includes information on all patients to whom the measure applies. Information in this presentation was obtained from the following sites: www.cms.gov EHR Incentive Programs, and also from the wikipedia.org Meaningful Use.